New right now at 4:30, more than 33 million Americans have tested positive for COVID-19. And according to a brand new study just out today, that number could actually be much higher. Researchers at the National Institutes of Health believe nearly 17 million cases were undiagnosed. Joining us live this afternoon is Dr. Scott Roberts, infectious diseases at the Yale School of Medicine. Doctor, thank you so much for joining us today. We appreciate it.
Thank you.
Explain how this could happen. Does it have anything to do with a lack of testing back in the beginning?
Yeah, first and foremost, this is not a big surprise. Many cases of COVID ultimately go undiagnosed for a variety of reasons. Early on in the pandemic, getting a COVID test was a lot more difficult than it is right now, really due to supply shortages. And we also know many people can be infected with COVID and show little to no symptoms. And this large group of people will never get a test. So all of this really results in an underestimation of this true number of people who are infected.
It's interesting because I think we all know people back in the very beginning, maybe last February or sometime around then, who said they were sick, they didn't feel well, and their own doctor would say, well, I don't have a test to give you. There's a really good chance it could be this coronavirus going around. Is that something that, looking back, you think was pretty common?
Yeah, definitely. And this is much less of an issue right now than it was when this study looked at this evaluation last summer. We do think there are more infections out there being reported in our positive numbers still, but this discrepancy is really a lot less than what you mentioned was in February, March, and April of last year.
What about this Delta variant right now? Obviously, I think we just reported yesterday it's growing and spreading quickly here in the U.S., now in pretty much every state. Do you think this could lead to maybe more undiagnosed cases over the summertime, or some people just maybe won't even get tested?
Yeah, I think we may see the pattern where people with little to no symptoms who are infected with all strains of COVID, including the Delta variant, will not seek out testing. And this could lead to a rise of cases in communities at risk with low levels of vaccination. And for this reason, we are continuing to stress people really continue to get tested with any signs or symptoms suggestive of COVID and to get vaccinated if not already done.
I was just going to say, this is your chance here, your final words, doctor. I imagine you would encourage folks, if they do not have a vaccine, to please get it, right?
Absolutely.
Okay. Dr. Scott Roberts, thank you so much for joining us this afternoon. We appreciate it.
Thank you.